so my presentation is on oil pulling. Has anyone, besides those I've like peer reviewed with, heard of oil pulling? Ever? Okay. So oil pulling is an ancient Ayurvedic technique, and it's a remedy for oral health and other detox effects. What you do is you take about a teaspoon or 2 teaspoons of oil and you swish it in your mouth for 20 minutes a day. And then what that's supposed to do is supposed to draw toxins out of your mouth and harmful bacteria, and it's supposed to bind to the oil. And then once you do that consistently, it's supposed to give you a whole bunch of health effects. And the effects range from like arthritis to oral health, skin issues, and all that jazz. So this is a quote from an Ayurvedic specialist. It is beneficial for strength of jaws, depth of voice, flabbiness of face, and good taste for food. One used to this practice never gets dryness of throat, nor do his lips ever get cracked. His teeth will never be carious, which means decayed, and will be deep-rooted. He will not have any toothache, nor will his teeth set on edge by sour intake. His teeth can chew even the hardest eatables. So, why I'm interested in this. First of all, my name is Georgia Simonson again. I'm majoring in agricultural education, and my minor is in nutrition. So I heard about this from my brother, and my brother is one of the most skeptical people I know. But he said this to me because he's like, oh, you might be interested in this because I'm really interested in alternative methods of healing. So for my report, my rhetorical situation is that I work at a naturopathic clinic, and many clients are asking me, you know what, can you tell me more about this oil pulling thing? I don't know much about it. So my question to my superior is, what information, or can I research this topic, and what information should I give our patients? What is our clinic's stance on this technique, and should it be a recommended process? So my audience is a clinic owner and supervisor, and then any other coworkers who want to know the answer to this. So how I did my research, it was really hard to find any information on this topic as it's generally new. It didn't get introduced to the US really till about 1992. And so it was hard to find a lot of sources. There were some online articles and then also online newspaper articles, so I didn't actually see any print articles, just images of print articles online. And then I conducted an experiment just to kind of see, to use real people as subjects to see if it worked. And then I gave them a survey, and then I also interviewed people who have done it for a longer period of time or who know about it. So first, for my experiment, I found 10 to 15 people to do this, which I was surprised I found that many. 10 people ended up being able to do it consistently for a week, and that's where I drew my information from. And what they had to do is oil pull once a day for 20 minutes for a whole week. And they couldn't start like any new exercise program. They couldn't change their diet drastically or get pregnant or any of that. So, they all used coconut oil. Now there's different oils that people recommend for this, but coconut was the least offensive of the choices of oil, and I wanted it to all be the same. So this didn't include different types of oil or a control group, just because I didn't have enough people. So the people who responded, there were 8 women and 2 men that did the survey, and the ages ranged from 13 to 59 years old. And this is my but anyway, which of the following of these health problems or issues that were you hoping oil pulling would improve? These are just the ones I picked. There's a whole bunch that people claim to have found benefits in. But, so like 60% of the people thought it would improve low energy levels or dry skin, sensitive teeth, and these are all the responses, and this again is out of 10 people. And of these people, one of the questions was, how many have you noticed any of these conditions get worse? 80% of the people noticed no negative effects from oil pulling. However, I had one person who said they had excess phlegm, and that was something they were hoping it would cure. And then one of my subjects actually called me the day I sent the survey. She's like, you should have sent it to me the day before. Today I got a whole bunch of canker sores. I broke out and my teeth feel really sensitive. It's like, well, I want to get all sides of the issue, so if it did, then that's good. I'm glad that, whatever, you had negative effects. I mean, I didn't say it. Anyway, she understood what I was saying. So there was one person who did find that it affected her negatively. And then, but of all the people who noticed improvements, these are the areas where they found improvements. Bad breath, low energy levels. A lot of people said it helped with dry skin and excess plaque. And then also sensitive teeth, gingivitis, and acne. So the next part of my research were interviews, and then John Blaska is a president of an Eastern Medicine clinic, and I asked him what his stance on oil pulling is, and he said that it's a technique they recommend to some of their patients. However, he does not think it has the detoxification effect. He's not sure on that, as many people claim it's a huge detoxifier. He said that isn't very likely, even though he's not sure. But they do recommend it to people who are struggling to maintain good oral health. And then also Ruth Carlson is a woman I know that I found out had been doing oil pulling since last August, and what she had to do was go in for a root canal because she had such bad pain. And her daughter-in-law recommended oil pulling to her, and within a week all her pain was gone, and she was like, now she doesn't have to get a root canal anymore. So those were the two subjects or the two people I interviewed. And then lastly, my recommendation on this, I did conclude from my survey that it does improve oral health, with 80% of the subjects finding improvement. But I did not find any scientific evidence from the survey that it's a cure-all or able to remove deep toxins. And I think more clinical research needs to be done in order to prove the validity. So for the verdict for the report is that it can be a technique mentioned as a supplementary method of healing, but not as a end-all be-all way to cure your problems. So, any questions? Yes, Carrie?
I know we've talked about how you started it. Have you personally noticed any improvement in oral health or any benefits from oil pulling?
I have. I've been doing it since March 6th. So I've been doing it for almost 2 months. And I noticed improvements right away. I did notice some things. What's the opposite of an improvement? Sorry, I just had a blank. I did notice some negative effects from it, but I don't know if it was coincidental. But I have noticed a lot of benefits orally, as far my face has been less dry. So dry skin was one that I found, and then also less plaque. So those are two effects I found. I don't have allergies, so I don't know about that and other things, but I do it almost every day, and I've noticed improvements. Any other questions? Yes?
So you'd mentioned that there are alternative oils. When you were talking to people through interviews or something, did they think that one oil was better than another?
Ruth, the lady that did it, she uses coconut oil. John, I did not ask about recommendations of oil with him, but on the internet sources, the most recommended oils are sunflower and sesame seed oil. Those are the two top ones. And then coconut oil was the third. But coconut oil is more prevalent, I feel, to all the people I asked. They all had that available, so that's why I used that. And I tried it using sesame oil, and it was really gross. I mean, I did it for 20 minutes, but at the end I just felt like my mouth was really nasty. But I haven't done it for more than one time though. So, any other questions?